During this pandemic, a lot of information and stories have been shared about how people, businesses, and schools have had to adapt to prioritize health and safety concerns.
But what about our jails and immigration detention centers? No one, whether they are a citizen or an immigrant, should be forced to live in conditions that endanger their lives.
Everyone in our region should have the ability to follow health expert recommendations to protect themselves during this pandemic. The country response to the COVID-19 crisis must center the needs of our most vulnerable communities and families to ensure an equitable, safe, and efficient response for all.
Given the history of medical neglect, the lack of adequate testing, and the increasing numbers of COVID-19 positive cases in our jails and detention centers, these facilities are jeopardizing people's lives.
Mass incarceration during this pandemic not only risks the lives of people in the system, it also risks the lives of people who work in these facilities, their families, and their communities.
So you might be wondering, what can San Diego do? Well, we must first acknowledge that COVID-19 is fundamentally a public health issue, not a law enforcement or criminal justice issue. For our jails and detention centers, they must increase testing.
So far, less than 3% have been tested in San Diego County jails. Only 25% of ICE detainees at the Otay Mesa Detention Center were tested, but that was only after our affiliate took legal action. And sadly, one person has died, and this death was totally preventable.
Our response should be a drastic reduction in children and adults who are incarcerated. We do this by releasing people who are medically vulnerable or who are not a risk to public safety, as well as by decreasing the influx of people into our jails and detention centers. The smaller our jail population is during this pandemic, the more lives will be spared.
For those being released from jail and immigration detention, it is critical that they have a safe place to go. The County Board of Supervisors must put a process in place to ensure people have access to the hotel rooms already secured by the county.
For those who remain incarcerated, facilities must take adequate measures to ensure that people inside are able to follow CDC health guidelines. With in-person visitation being limited, incarcerated people should also have access to free telephone calls.
For law enforcement, low-level arrests or citations should only take place when there are no other reasonable alternatives to protect public health. Instead, officers could refer people to other agencies or resources that can help them in their compliance with government directives.
We know what the solution looks like. We need our elected officials to act on them. Here are 3 things you can do.
First, join us in calling and emailing the Office of Probation, Sheriff's Office, and the District Attorney, and urge them to protect lives by releasing as many children and adults as quickly and as safely as possible, to limit enforcement of low-level offenses, and allow free phone calls for those who remain inside. Go to our action page for more details.
Second, make sure your voice is heard at the next Board of Supervisors meeting. You can provide e-comment or participate live via telephone.
And finally, share our social media graphics to increase awareness. Together, we must flatten the curve of inequality.